So at Laureate, we do have adolescent and adult tracks with completely separate treatment teams, separate physicians. So the adolescent track is really about dealing with young women that are usually in school and are going to go home to live with a family. And so a lot of the emphasis is on family work, preparing families, and transitioning to families. When a patient comes in the hospital, first of all, it's overwhelming. I mean, this is a girl who's facing her worst fear 6 times a day. A lot of times she's far away from home. Most of our patients are from out of state. She comes into a very supportive environment. So we have teams of therapists, dietitians, nurses, and doctors, all which meet with the patient and talk about the patient on a daily basis. When they come on the unit, from the time they get up in the morning till the time they go to sleep, they're very closely monitored. We're following their fluid intake, their food intake. They're doing different therapies throughout the day. So we have experiential therapies and movement and art. They're getting process-oriented therapy, individual therapy, family therapy. So their day is pretty chock full of really working on not only nutritionally restabilizing them, but physically and emotionally restabilizing them so that they're ready to be back on the road to recovery. The process of being here in the hospital is really from the day they get in the hospital. The hardest part is to think about the day they leave. And that's always on our mind from the minute they're here. We have a wonderful staff that does a really good job of containing patients, controlling behaviors, monitoring them. But if that doesn't stick, if they're not able to do this when they get out of here, that's all in vain. The advantage of being in a place like this is it can be a break from everyday life, and we have patients from California, from Connecticut, and coming out to Tulsa, Oklahoma, coming here, it's a break from things. They can actually be in an environment that's very supportive. It's away from the hustle and bustle and things that stress their illness. And they can really come in and dedicate themselves to their recovery in an environment that's peaceful, that's tranquil, and that provides them with the ability to reflect and plan for their future.